I could do a couple miles and be okay. Then it became shorter and shorter. It got progressively worse. I loved to go to baseball games. I was barely able to walk across the street from the Metrolink station to my seats without a lot of pain. Anything that wasn't absolutely level was extremely painful. I had another orthopedic surgeon evaluate my ankle. He said, "Now that's an 80-year-old ankle." I was in my 50s. So I said, "That's probably not a good thing." He said, "No, that's not a good thing." The options I had were to fuse it, which is in essence you lose your ankle, or live with it. So at the time, I didn't want to lose it, so I was bone on bone for probably 10 years. I like to play golf, and 18 holes became impossible. Anytime it was cart path only was usually a day I didn't play because I just couldn't walk that far. That's when I started asking around, and someone had an ankle replacement surgery, and that person had a good experience, told me about Dr. Schergen. And when I did a little investigation of Dr. Schergen, I found he was extremely well schooled in ankle surgery. It wasn't just a part-time thing. That was his specialty. So that gave me a lot of confidence. And then, of course, talking to a patient who had a very good experience as well gives you that little bit extra of confidence that maybe he's the right guy. When I had that initial evaluation, he said, "You only want to do surgery when you're at a point where you really can't live with it anymore because it's affecting your life." And it was. I just couldn't do things that I enjoyed to do, and it was extremely limiting. So at that point, you just have to do something. After the surgery, he was very encouraging, and I mean, truthfully, it almost felt he was just as excited as I was each exam or each visit to see how well I was progressing, and that really made me feel good. He set expectations in a way that I wouldn't be disappointed, and we would both agree that getting 90% is wonderful when you can't hardly walk across the street. You know, now I can play golf, I can do anything I want to. 90% is great. It's as good as I ever expected it to be, and it's much, much better than it had been for probably at least the last 5 years before I had the surgery. Looking back, I should have had that surgery at least 5 years before. One thing I would want to make sure that if anybody was having problems and weren't sure about what to do, a visit to Dr. Schergen's office will reassure them of two things. One is somebody cares about them, and if there is something that can be done to help them, Dr. Schergen would be the person to do it.